Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it.
Hi, Danielle. It's great to have you back. I see that you have Buck with you today.
I have my beautiful
underdressed as always. All right, so let's get started. This is unusual in that we brought you back a second time, kind of in, very recently heard you talk, and now people are really still eager to learn more. So thank you so much, Danielle, for agreeing to be back on this in the Healing Grove, because, the call was loud. So we're super excited. So I'm not going to do a full introduction, and you don't have to tell your full story, but can you just maybe remind those people who haven't reviewed your last video yet, who you are, what you do, and then tell us what we're doing today.
Absolutely. So my name is Danielle Pilarinos, and I'm a biomagnetic pair therapist, also an herbalist, but mostly what I talk about here is biomagnetism. And that is where we're using magnets to help balance out the pH of the body. This is like the elevator pitch. To help balance out the pH of the body and eliminate areas where pathogens would be living. So every time we're finding these little imbalances and shifts in the body that are either housing pathogens or emotions can be stuck there, past trauma. We can also address injuries because the magnets increase circulation and oxygenation to the tissue. Those also really beneficial for sports injuries, brain injuries, recovering from surgery. And it's a really cool therapy because it's one of the few therapies that you can do at home easily and affordably. So that's one of the main reasons I love it, is to be able to just empower people to use it at home. And that's why we're here today.
Awesome. So I know people submitted questions. Members in the Grove submitted some questions. I don't know how many questions you've received thus far.
Just a couple. And then if anybody has more, we can put it in the chat and I'll try to watch the chat there. Let me pull it up. Or Jerry can let me know.
So I have one that I didn't submit. Can I ask it now?
Of course.
It feels like a kind of important one, especially for people who are new to this therapy. Are there any people for whom this therapy is contraindicated, meaning anyone who shouldn't buy a pair of magnets and start using them willy-nilly on themselves?
There really isn't, but that's a great question. In the case of if you have an implanted medical device like a pacemaker, a cochlear implant, something that's using a battery, or just you're going to want to be careful about not putting the magnets near that. But that doesn't mean you can't benefit from biomagnetism. You're just not going to want to put the magnets. Let's say you have a pacemaker, you're going to want to avoid that heart area, but you could for sure put magnets on your shoulders or your neck or someplace else. But there really isn't. I've dealt with very, very ill in-stage cancer patients, and we've really had no ill effects. We do with pregnant women. So there isn't really a time when it's not beneficial. So that's another really cool thing about it, is that everybody can do it.
Awesome. All right. Well, I'll let you get to it. Thank you for that initial non-warning.
Yeah.
Non-black box label.
And then somebody just said metal rods. So if you have, you broke a bone and you have metal inserted in the body, those metals are they're always not magnetic. Okay. Not all metal is magnetic, just like a magnet's not going to stick to your stainless steel refrigerator, the front of it. So the easiest way to know is if you can use magnets and you have a metal implant is if you're allowed to go in an MRI, a magnetic resonance imaging machine, then the magnets are safe to use.
Great. That's a great general rule.
So I'm going to go through the questions here, and then Buck's going to help me out. And I thought we could demonstrate some really universal places to place magnets and some protocols for everybody to use at home. Because you and Jerry and I were all talking and we're like, everybody has magnets now. Why don't we just do this fun little bonus of showing them how to use it? So some of the first questions. So somebody was asking, they sent kind of a list of questions, and one of them was, let's say you have a condition like headaches that you get frequently, or this would apply to anything, reflux, any kind of chronic condition. Can the magnets be used to quote unquote like cure it or address the root cause, or do they have to be placed every time? And the answer is a little bit of both. So if you have used the magnets enough and you understand how to use the protocols at home, you should eventually address that root cause of what is causing the issue. In this case, they were asking about headaches. Okay, so eventually you should have addressed the root cause. Why are the headaches occurring? But it is also always nice to have the magnets on hand and know how to use them in an acute situation. Because even when you have a chronic health issue, it clears up most of the way. We still have everyday ailments that pop up. Things flare up. So it's good to know how to use the magnets in an acute setting like that. If you can put them on and avoid migraine medication or taking, ibuprofen or something, so you can have them there for that. So I hope that answers that individual's question. It's a combination of both, but yes, biomagnetism should get to the root cause eventually to address the root cause of the issue. Same thing, that same person asked about, like they have a mom whose knee, it foretells the weather. The knee that acts up whenever the weather changes. That would be a great time to know how to use the magnets in an acute setting. And I'm going to teach you that protocol today. I call it a trauma protocol. So it's anytime you have like an injury, you were working really hard in the garden and now your knee's bothering you. We'll teach you that today. But eventually you should be redressing why is that inflammation. Just like a lot of you are doing the elimination diet, right? Like you're just eliminating all of these causes of inflammation and issues. And then two other big questions that came in. One was about clearing up, this is very specific, plantar warts. Biomagnetism, yes, eventually it could do that, but warts are kind of tricky to clear up. Like that is a really systemic virus and they get in there. Would it make it go away? It probably would if you worked at it really consistently. It would take more than like 1 or 2 sessions. That's something that you would want to work at it at home with to eventually eliminate it, just because it's one of those really kind of deep set issues. And then asking about BPH, benign prostatic hyperplasia. So benign enlargement of the prostate. So for sure you would use the magnets. You're going to use the same trauma protocol that I will teach today. So I'll teach that in just a minute. But also, anytime you have like an organ you want to work on or something's acting up, the easiest thing to do is take your magnets and do a vertical pair like this. So kind of black either towards the head and red towards the feet, or the prostate, right, is midline. So you would have somebody sit on these magnets, essentially like this. Their bum would be there, black facing the front of the body, red the back. And you could just have them sit on those magnets every day for a half hour or so. That's going to help bring down the inflammation. To treat the root cause of it, you're definitely going to want to have some more in-depth biomagnetism sessions, but that is an easy enough thing that you can do at home. That and this other protocol, the trauma protocol, very loosely, we'll call it trauma. It can help with any time that there's inflammation, including an enlargement of the prostate.
Danielle, I have a quick question.
Yeah.
Because I know some people will ask this. When you're saying black towards the front of the body, you mean the side of the magnet touching the body?
Correct.
Is the black surface.
Thank you. Thank you for helping me clarify that. Yeah. So when I'm talking about the sides of the magnets like black or red, what I'm talking about is the side facing you. So it will be a little confusing when I put it on buck. Generally, I'll put it like demonstrating, because if I say the black, it's what's facing you, but you see the red on the outside. So when we talk about the color, it's the color of the magnet facing the skin. Yeah. So if somebody has prostate issues, you can just have them sit on that every day.
And does it matter which one is on top?
Like this?
Mhm.
No,
Doesn't
that's
matter.
not a question I get. Good observation. No, I don't get a lot of questions. Easiest way to keep magnets in place, masking tape. So you can, there's a couple little hacks here for keeping them in place. So you can use masking tape and you would tape it on. Or if you're laying someplace, and let's say you're putting your magnets on and you're laying in the bed or on the couch, you can lay on some magnets behind you. You're putting them on like your kidneys or your back. So you're laying on them. And if you have stuff on the front, you don't want to use tape, you can get like a little weighted sandbag or, eye mask that has little beads in it. And then that can hold the magnet in place for you also. Put it underneath there. For the head, if you have enough hair to do this, I usually use a metal clip. I couldn't find my big ones today, but a little metal pin curl clip. And then you put it in like that. And you stick your magnet on it. And it will hold the magnet to your head. That way you don't have to put tape like on your hair. If somebody doesn't have enough hair to clip it to, put a baseball cap or a beanie on. And you either tape the magnets to the outside of the hat, or you can like tuck it up underneath the hat. The hat can hold it in place. Headbands. Those are the easiest ways. Oh, the other way too, you have enough magnets. I always have a ton. You can layer them on your clothes. So the magnets attract to each other and it pinches the clothes in between and it will hold them in place. So I do this a lot when I'm driving. I do my little magnet detox when I'm driving and I like stick it in my shirt and they'll sit there. That's how I fit it in. So those are easy ways. Let me see here, a couple more questions across. Is it important for the magnets to be? No, it's not important for them to be directly on the skin. You can have clothing in between. Oh, I see you answered that, sorry. Any other questions before I go on demonstrating some protocols for everybody?
I actually have another question. I've been talking biomagnetism up, and I spoke to a person who got really excited about magnet therapy. Mm-hmm. And not sure if it was biomagnetic pairs, but he said, I got really excited about it, but then I ran this idea by a couple of my friends who are, Qigong masters, and they both said, listen, do not use magnets. They're going to reverse the polarity of the body. I wonder if you've heard that before, and if you can speak to whether that's about biomagnetic pair therapy or something else, and what your response would be.
So my first question was, what do they mean by reversing the polarity of the body? That's kind of a vague statement. I would want to know what they have to mean by that. And I would say it's probably a big difference between the pair therapy, because we're using pairs of magnets, a black and a red, north and south, always in conjunction with each other, versus magnet therapy, which is sometimes people lay on pillows that have magnets in them, or like a mat over a mattress. So, and in that case, you are primarily exposing yourself to one pole. They generally either use the red or the black, and that's all they use. And so then you are exposing yourself. But still, I'm not a big fan of that because it's not as balanced to me. And with anything, I think it should be done in moderation, like kind of anything you do. But honestly, the earth is a magnet, right? Like we live on a giant magnet. So to think that like an overexposure of one or the other is going to create some kind of reverse polarity in the body, that's not something I have ever personally worked with. And I've had some clients who had like acupuncturists or other people from like more of a traditional Chinese medicine perspective say that they had reverse polarity and everything. If they did it one way, their body reacted the opposite. And when they did biomagnetism, then went back to their acupuncturist, that reverse polarity was corrected. So that is like my very limited experience with it. I don't know if that was a good enough answer, but those would be some of my questions. And it's true, like I'm not a big fan of people wearing like magnetic jewelry, like they'll have those. I think it's better to work with them very specifically placed in pairs so that you're constantly keeping that energy balanced in the body instead of like always being exposed to one pole or the other.
Yeah. Which
That
is
was
like what they were talking about. So thank you.
Yeah, so it's a little bit slightly different. Here's another one. Hello, wondering what magnets, sorry, on your eyes. Yeah. Yep. You can absolutely use magnets on your eyes. So sometimes if I'm like, ooh, having a rough night with my eyes, I'll even put a little eye mask on, and then I'll layer the 2 little magnets on the eye mask, and you can sleep with them or take a nap with them on. So you can certainly try putting those around your eyes. If you wake up with like eye crusties a lot, I find that if you put magnets on your eyes regularly, you won't have those. It really helps clear that up. So there you go. Do you always use a pair? Do you just want, you always are going to use them in pairs. Pairs as in at the same time, you'll have an equal number of magnets placed. If that answers that. This question is from Katie. Do you always need a pair or you just one on each site? So the pair is always, it's not, how do I explain this? So you can have a pair, and I'll show you guys like a bilateral pair today. For shoulder pain, let's say, you could do a black facing the skin on the right shoulder, a red facing the skin on the left shoulder. That would be a pair where they're kind of both, right? You could also do a vertical pairing or horizontal pairing on the liver to help detoxify the liver. But there are also some like really unusual pairings. One that I'm going to teach you today, which is great for just supporting the whole endocrine system and supporting your adrenals, which most of us need some help with. The black magnet actually is going to go on the front on your sternum on the thymus, and the red is going to go on the back near the adrenals. So that's another pairing, but they're not in the same location. But it's still a pair because you're using 2 magnets. Does that make sense? Yeah, okay. If we need further clarification, let me know. All right, cool. Well, do you have any other questions, Kristin?
No, let's get into it.
Let's do it.
Do it.
And then later I did ask Jerry, was just brave enough, and she was just using her magnets at home, like, okay, I'm going to do it. And she had some cool experiences. So before we get off today, I'm going to let her talk about that because she was just like, oh, I have them and I just put them on. And that's, I would love for all of you to use them. So, all right. One of the first things, let me teach you that trauma protocol. So this is used whenever you have an acute trauma, like I sprained my ankle. I had knee replacement surgery. Or if it's an injury that's not healing well, like an old rotator cuff tear. So in any of those circumstances, you can use it, kind of why I call it a trauma protocol, but you can also use it if you're having a lot of pain. So you have, like the one member asked, like, okay, my mom's knee acts up whenever the weather changes. You could also try this in that circumstance to see if it helps. The main purpose of this is to reduce inflammation and increase circulation and oxygenation so that it heals. And my clients that come to see me when they've had like replacement surgeries of some sort, knee, ankle, and they use this, they tend to, on average, recover about 2 weeks faster than what was expected. So it's pretty, especially if you do it every day and you're kind of very, very consistent. All right. So for trauma protocol, this is, you're actually going to need a total of 6 magnets. So 3 pairs. And I'm going to do it on Bucks. You guys can still hear me? Hear me? Okay. I'm going to do it on his shoulder, just so everybody can see. But this would apply anywhere on the body. And it doesn't matter if it is right or left side. You're going to do this exactly this way, regardless of where in the body, regardless of what side. Okay. You're going to take 3 medium pairs of magnets. It could be small, doesn't matter, I guess, what size. 3 pairs of magnets, you're going to stack them 1, 2, 3, like that. Okay. You're going to put red side facing the skin. So I just put my tape on there. We're going to put it on Buck's shoulder. Red side facing the skin. Okay. The next 3 magnets that you're going to place, because we're making 3 pairs here, this is kind of the shortcut for how to do it. The next one is going to be black, facing the skin on the bladder, which is below the navel and above your pubic bone. So if you push on your belly and you're like, oh, I have to pee when I do that, that's your bladder. Black there. Actually, I'll put that on. Because we're also going to put it on the kidneys. So we're going to turn back around. And you're going to put a black on each kidney. Right kidney, left kidney. Kidneys are at elbow height on your back. That's approximately, you kind of bend your elbows like this, and you're going to get the general location of where your kidneys are. They're behind the ribs back here. So if you're kind of pushing down here and there's no ribs, you're too far down. So black, this is Buck's left kidney. A black on Buck's right kidney. Turn them around. And then a black on his bladder. That's your trauma protocol. So what you have done is you have made 3 separate biomagnetism pairs. You have placed bladder to shoulder or area of injury, right kidney to area of injury, left kidney to area of injury. It's just easier to throw the 3, stack them like that because you're going to do it. Okay. You can leave that on for as long as you like, because this is slightly different than balancing pH and all this other stuff that we do. This one is really about circulation and reducing inflammation. I would leave it on a minimum of 30 minutes, and you can leave it on up to a couple of hours. So it's Friday night and you want to watch a movie and your shoulder's bothering you, put that on.
And to be clear, the bladder and the 2 kidneys, black against the body, do not change, but the shoulder stack is going to be wherever the pain is.
Correct. Yeah. So it could be, I don't know, you were lifting weights, you were doing like, your bench presses, and you like messed up your pec. You like tore your pectoralis. You could put it here. You could have an elbow injury. Movement. You could put it wherever that area of pain is, right or left side, doesn't matter. What we're demonstrating today is his shoulder, but anywhere your area of injury is. This is just closest to me, so it's easy. So 3 red here, the area of injury, black facing the skin on the bladder, and both of the kidneys. Okay. So this is so easy to do if you're recovering from an injury. And you're just sitting there, right? Like, I don't know, you twisted your ankle and you're sitting there having it elevated. You put these magnets behind your back when you're sitting in the chair, and that's what holds them in place. Tape the magnets onto the area of injury. And the bladder, if you got higher waisted pants on, you could definitely tuck the magnet like in your pants, and it will stay there also. It doesn't really matter how you get it to stay in place. So again, that's the basic trauma protocol. This is like, just remember, like, yeah, like you're going to reference this every time you have an injury or something is hurting. You fall and hit your head. Your kid falls and hits their head, obviously seek medical care when you need it. Leave them on a minimum of 30 minutes, and you can do it up to several hours. And you can do that every single day. So the clients that helped recovered from their surgeries, like ankle replacement or knee replacement, they put them on every single day. And that kind of consistency is what's going to help it heal much faster. It doesn't really matter what size magnets. The mediums are just the easiest to tape on. Question just came in here.
Danielle, what if you had like bilateral shoulder injuries or pain? Can you do more than 1 trauma protocol at a time? And if so, yes. Are you stacking like 3 here and then 2 everywhere else?
You can do both. I would normally stack them because I just have so many magnets, right? I just have a ton everywhere. But if you wanted to put multiple on, you could also set that intention of like, okay, this black magnet is resonating with that one and that side. So that is where some of this becomes into like energetic medicine and that intention of where we're using them. But if that's like a little too out there for you, just stack more magnets on, you know. So if you wanted to do another trauma protocol, you know, the other shoulder. Then yeah, put another black on the bladder and black on each kidney. And I did this to demonstrate that you can use whatever size magnets you have. So let's say you don't have 6 pairs of mediums or 6 pairs of smalls, or, you know, you can stack smaller or larger magnets, and it doesn't really matter. It's just the idea that that magnet is there and that magnetic force is there. So a lot of times when I'm stacking, I use smallers because they don't fall off as easy with the tape and stuff. So it doesn't, that is kind of, doesn't really matter. So you can use whatever you have. If you only have big magnets, or you have, you know, 1 pair of each size, you can stack however you need. All right.
So can I ask a question? I'm thinking about this from like a Chinese medicine sort of perspective, and thinking about what kidney and bladder do in an acupuncture treatment or circuit. And they're, you know, bladder in particular, especially good for kind of releasing and relieving and pulling things out of the body. So is that a kind of a construct I could use to sort of imagine you're activating that, where that you're starting where the problem is and the inflammation is, and you're kind of pulling it down towards the kidney and bladder for removal?
Correct. That's exactly it.
I love it when things start to overlap and I don't have to learn one more thing. That's awesome.
No, I mean, that is the cool thing. Yeah. And all of these therapies, they're all just pieces to the same puzzle, and they interplay. Yeah. So I tell people to think of it as like the inflammation or swelling, you're trying to get that out. And how do we get water out of the body? Kidney and bladder. All right. So last time we chatted, we talked about lymph system, right? Does everybody remember that? That's subclavian. Right here is great support for your lymphatic system. Let me take everything. So we'll start with that. Now, if you have, let's go back to lymph for a minute because it's so important. And this is the main, facing the skin here, black on the right, red on the left for lymphatic support. Okay, main. But a lot of times people will have swelling in their lower legs. Okay, they're recovering, or maybe you're on a long flight, you just don't have great mobility. To boost that lymphatic support, you're going to place the magnets here in the groin. The femoral artery, femoral veins are in here. They kind of all come through this area. You have lymphatic vessels there. So you can also put in the groin, back on the right, red on the left. So if you wanted to up the circulation in the legs, we have swelling, lymphatic issues, not just up here, but we really want to incorporate it into the lower extremities in the groin. The other pairing that we talked about, was going to touch on it briefly, is liver, support for the liver and detoxing it. And that is going to be a vertical pair, black, red on the liver, right here. The liver is behind your ribs on the right side. So if you're going to put this on you and you're squishing in your belly and it's soft, you're too far down. The liver is behind the ribs because it's really important and your body wants to protect it with some extra bones. So this vertical pairing, black and red facing the skin. For those of us who, if you wear a bra or you wear camisoles or anything with an underwire or a strap here, you can tuck that magnet up underneath the strap and it will hold it in place. That's another way to kind of put your magnets on and chill for the day. So lymph, liver, let's go on continuing the detoxification pathways in our body. There's a couple more important ones. One is our urinary tract. So same vertical placement, black and red. You're going to put it on your bladder. Really beneficial if you have, this can help in cystitis, or if you have a UTI, or some other kind of just bladder irritation that's going on. That's really beneficial care. So you're going to notice that when we have one organ, vertical pairs, it's pretty easy to think of it that way. Bladder. The other part of our urinary tract is going to be our kidneys. Now, we have two kidneys. So in this case, you're going to put a black magnet facing the skin on the right kidney and a red magnet facing the skin on the left kidney. So pretty quickly, with 4 or 5 pairs of magnets, you can do like a full body detox in the matter of like 20 minutes. Right? You can put on your lymphatic pair, your liver pair, kidney pair, bladder pair. Did I say that? Bladder pair. And you can have all of these on at the same time. There's not such a, it doesn't matter if you have too many on. You can do them as often as you want. If you'd like to do it every day, that's fine. If you want to do it once a week, it's better than never. If you want to do it once a month, it's one of those that you can incorporate it however it works with your wellness routine. And I try to really encourage people to find a way where it fits and it doesn't feel burdensome. Because especially when you have chronic health and complex health issues, you are the healthiest sick person, right? You're doing all the things, you have all the supplements, you're doing the breath work and the meditation and the sauna and your exercise and your creepy crawlies and your so many things, and it can get really overwhelming. And I would rather you do less and not be overwhelmed if that's possible. Like if you can work it out at all, brilliant. So as often as you can work it in, that's fine. Don't feel pressured like, oh, if I don't do it every day, it's not enough. Doing it at all is going to help. All right, so the other pair that I love, or heart health, circulatory health. I recommend this to anybody who has heart disease, a family history of heart disease. I'm the youngest in my family, and my father and both my brothers have heart issues, so I do this on myself regularly. Is on the carotid arteries here in the neck. Great pair to increase circulation. Think of it as just like magnetizing the water pipes, like the main water pipes of your body. Okay. So again, because it's bilateral, we're going to do a black magnet here on the right, and you're going to put it exactly where you feel your pulse. You're working out and you're like, oh, what is it? That's where your carotid artery is. Red. Super easy. You have like a high neck shirt, turtleneck, you can stick it in there, layer it, it works out. So it's not quite as good for AFib. For that, there's like a little bit other ways I would dig into that. And you could put magnets over the heart if you don't have a pacemaker. If you have a pacemaker, please do not put the magnets over your pacemaker. But you could always try a vertical pair right over the heart. I wouldn't say that pair for AFib.
So the concept of the vertical pair, which we've looked at now for liver as well as bladder, and now you're saying heart, is that, and black on top, red on the bottom, is that you're basically like bringing juice to that organ specifically.
Yep. So you could do it on the spleen. If you're having like anemia issues, or you have an enlarged spleen, or you could do it on the spleen. You have gas in your belly, you can do it on the large intestines, ascending, transverse, descending colon. Your large intestines, like, okay, smalls are like swiggling around in here, and then they connect down here in your right lower quadrant, and then they go ascending, transverse, descending colon, and out. So if you have pain in one of those, you have diverticulitis, you have gas, you have like this bubble that's just sitting there not moving, you can kind of put it there, put it there, put it there, anywhere you need it. If you have two of one, like two things, right? I have two kidneys, I have two shoulders, I have two carotid arteries. In that case, you're doing the black on the right, red on the left protocol. Okay. So if there's only one, vertical. You have two, black and red. Does that make sense to everybody?
You mentioned earlier, it's okay on pregnant women.
Yeah.
So can you treat the fetus?
In theory, you can, yeah. What you would do is you would use the mother as a surrogate for the fetus. So when I have done that, I muscle test the mother for the fetus, then place, obviously I can't put the magnets on the fetus's liver, right? They're moving around. The mother, it would be the energetic surrogate for the baby. And then you would put the magnets like on the mom's liver or wherever that part was. Yeah. I have also used magnets to turn breech babies. If you think of us as a magnet, like head is the North Pole, feet are the South Pole, right? Like a human being. Opposites attract. So the baby's North Pole should attract to the mommy's South Pole. So that's why the head should be down. So if you help make sure that there's not some imbalance in there that's kind of skewing that energetic field, you do some work on the mom, you see it, and then I've seen them just go turn right around.
Nice. What about constipation is a question in the chat.
Try it on the intestines, right? Because constipation is like a really big issue, right? Like there can be so many reasons for constipation. And I'm sure you guys have talked about this. A lot of you are doing the elimination diet. You're trying to see like, oh, is the food causing the constipation? So it is a bigger issue that sometimes it's hard to have one pair for. But you can initially start working on the gut. Interestingly enough, there is a specific pair for constipation. It's kind of it's on the back. And it's right at the iliac crest here. So the iliacs are like the hip bones that come together. And it's like right here, kind of low back, upper butt cheek. And it would be black on the black on the right, red on the left. Black on the right. Low back, upper bum. It's kind of one of the pairs for that, but I would try it that way. There, you can work on the gut too, because you're going to have to heal the gut. Really, to get to the underlying cause of constipation, we have to heal the gut. So that's going to be multifactorial there. But yeah, so if you're having like, ooh, rumblies in your tummy, they're not really happy. If you had enough magnets, you could do like this little kind of U shape. Or like ascending transverse, descending colon. Yeah, that's gut. Let me show you one for the brain. So the carotid arteries is great for the brain also, because it's really close to your head and getting good blood flow up there. So that's a good one. But the other one that I really like for the brain is temple. Temple to temple. And you may have noticed by now that a lot of this is really intuitive. Like kind of put the magnets near where it hurts or where the issue is. Let me see, let me move this up so we can see Buck's head. Buck is very tall. I'm 5'7", he's so much taller than me. All right, so you're gonna go on the temples here. He is black on the right and then red on the left temple. Great circulation to the brain. Black on the right, red on the left. That's good for headaches. Try that pair. If you're having headaches, you can try that, like during the headache. If you are really tapped out and you still have a very long day ahead of having to use your brain, that can give you a little extra brain juice. You know, so sometimes I'm like midday and I'm like, holy cow, I don't know. Like I just don't have like the cognitive abilities anymore. Like I will put that on. And it just kind of just makes things a little bit clearer, brighter.
Nice.
Getting some extra juice there.
Speaking of brain stuff, I was at a girls' weekend all weekend with my Yale swimmers from my past. It was amazing. And of course, much of what we talked about were menopausal symptoms, and people were talking about brain fog and sleep issues and some of the brain stuff. Is that a good one for that as well? Or is there like more of a comprehensive treatment for menopause that kind of gets all the birds?
There's more of a comprehensive, but start there. Right? If that's what you have access to and you want to try it, start there.
Nice.
Yeah, like I do have a 3-part brain health series in one of my video libraries. So that would be much more extensive for like brain health, brain fog, that kind of stuff. But that's one of the pairs in it.
Nice.
I work with somebody who has a traumatic brain injury. I always put that on there. If we're doing a lot of brain work, always put that on. So I really wanted to give you guys tools of like, okay, just do it at home, give it a try. You can always go further down the rabbit hole, but start here and it's not overwhelming.
Yeah.
It's pretty, like I said, it's pretty intuitive. Like, oh yeah, I want my brain to work better.
Yeah. And it seems like you kind of can't go wrong. It's a little forgiving and it's not gonna hurt you. It's like a little bit like homeopathy. Like it's not going to hurt you if you pick the wrong remedy.
Exactly. Yeah. So overall, endocrine system support, a little bit of immune and endocrine. Thymus gland, smack dab in the middle of your sternum. I write it, well, it's not quite in the middle, but upper third of the sternum, black on the thymus. And then this is, you technically have 2 adrenals, right? Like this sit on your kidneys, but you're going to put this in the middle. Red on adrenals. If you have a bra and like the clasp for the bra, it's about where you'd want to put your adrenal pair. So black on the thymus, red on adrenal. That's just a really nice endocrine support, adrenal support. I'm feeling really taxed and stressed out. There you go. I'm looking here at, in general rule, this is in response, I can't see who it's in response to. Oh, to Bonnie. For the trauma protocol, because that's slightly different, that you're going to leave on 30 minutes to like 2 hours. For the rest of this, you can leave these on like 20, 30 minutes. If you live really far north, like I have worked with recently a bunch of people from Alaska, you're going to need to leave them on longer. The further you go away from the equator, the longer you need to leave them on. And in that case, you're going to be closer to 45 minutes. If you're like really far north or south, right, on the earth.
But I also heard you say you sleep with them sometimes. Can you not go too long with them? I mean, is it going to hurt you to have them on all night?
No, I wouldn't do that all the time. Now I had a UTI a couple of months ago. Forgot how miserable those were. And I was like, oh, that's awful. I was like, I cannot. I have so many friends that have like chronic cystitis. I was like, how do you live? I put big magnets on my bladder and slept with them because I made a difference. Like it really helped take that edge off. And I just tucked them in my panties, you know, and it just kind of, they stayed there. Mm-hmm. I would do it in that case. I wouldn't do them all the time. I wouldn't sleep with them all the time, but occasionally it's not going to hurt you.
So there's a couple of questions in the chat. One is about, can you use these for Lyme disease?
Okay. Yes. It's going to definitely be more complicated than this, right? Because Lyme, somebody comes to me with Lyme, we're going to be addressing like where in your body are all these pathogens and co-infections and everything hiding out and clearing those areas, right? So that those pathogens can't live. Like, where is Bartonella in you? Where's Babesia hiding out in you? Also would address a lot of the emotions that come up not only from having chronic health problems, but that can trigger it. You know that a lot of times a lot of people talk like, oh, I had this major life change that happened and then I got Lyme, or that like, those all correlate and we can address those. So yes, we can work with like Lyme. It's a little bit more complicated, but you can for sure even work on yourself at home. I can help guide you through some of that, have the videos to use at home. But if somebody had Lyme disease, I mean, you can correct me, Kristin, but I like to say, I'm like, if you have like complex or chronic health issues, you can just about guarantee you're a poor detoxifier. Right? Like that's at a core, like undermethylators unite. Like I just, not gonna like detoxify well. So put magnets on your liver and your lymphatic system regularly. You can do that at home and start addressing some of those like really root causes that create the overwhelm in the body.
And I would say that thymus adrenal pair is probably also going to be really important for people. Someone asked a question about PANDAS, which is a autoimmune brain issue from toxins or infections. And they said, would I use the brain, like the brain fog points?
Sure. You can absolutely use those. PANDAS, we're going to go down a strep rabbit hole. That's so again, we're looking at like if you really want to get to the root cause of it and clear it up. And I've had some amazing success with children and with PANDAS. But for sure at home, try those. And if you notice that it makes you feel a little bit sharper and clearer in the morning, great. Do it as often as you want. Yeah. When I use them, I feel a subtle buzz. Ooh, Missy. So that's just the energy change and flow. If you've had acupuncture, you know, sometimes you put the needles in and you can feel things shifting, or you like fall asleep all of a sudden, you're exhausted. Same thing. The magnets, they're just working on that energy level of the body. It's moving energy around. It's maybe you're getting better circulation there. So you're feeling like, ooh, like tinglings from better circulation. Yeah.
So actually speaking to that, I also feel that when I do the magnets, and it does feel a lot like an acupuncture treatment. And typically when I do acupuncture on someone, I tell them, you know, for 24 hours after, make sure you're hydrating like it's your job. You're resting if you need to, you know, you're listening to your body and kind of doing what it asks you to do. I usually tell people to avoid cold foods and drink, and to avoid extraneous activities just for 24 hours. So do you have any similar things that you might tell people after they're doing magnets on themselves or after they get a session with you?
For the magnets that you're going to use at home, I wouldn't, like watch your water intake. But generally when you're doing them at home, you're not going to be doing that huge of a session and doing that much. If you come and see myself or another therapist and you have like a full session, absolutely. Like, yes, make sure you hydrate. You might feel a little tired. Generally, people don't have real bad hercs or detox reactions, or at least I try to avoid that with them by working on their detoxification pathways. Strenuous activity. Yeah, it's just like listen to your body. If you're kind of tired and you want to rest. Make sure you're drinking, like hydrated, that kind of just respect what your body's telling you. So for sure, if you have like a bigger session, yeah. And then if you start getting them regularly, your body kind of is like, ooh, you know, you adjust to it a little bit more quickly and it doesn't kind of take it out of you as much. But for what you're doing at home, there's probably not enough magnets that you're putting on that would require any of those disclaimers.
So let's talk a little bit in the last few minutes about how people could work with magnets. We've been talking today about things they could do at home, and you've shared some lovely ideas and pairs, and thank you for that. That's really, really helpful. And I think everyone who has their magnets are already probably taping them on their body. And that's one way to do it. Another way to do it is to buy your packages which have videos of even more things. Yeah. And then sort of the further would be to work with you directly, either in person or virtually. So say a little bit more about each of those options, if there's anything that wasn't included in my little quick overview. How about?
Sure. Those are the options. So if you have magnets, you can use them. You learn here. On my website, I have blog posts and Instagram, like social media, TikTok, that kind of stuff, that I have videos showing, again, some basic pair placements like this. So there's a ton of free content for how to use the magnets. I do have video libraries on my website and 3 different levels of those. And they have protocols of more complex placements than this. Like, okay, this would be the one for gut health. This would be the one for anxiety. This would help you if you have insomnia, if you're having difficulty sleeping. They're a little bit, they're between 4 and 6 pairs per protocol in general. But Buck is my model for those also. And I'll just show you, same thing how I'm walking through with you right now, showing you where to place them and what it would be beneficial for. Those protocols are laid out like that. And the professional plan that I have has all of them that I've made so far. I'm in the process of recording more. So those will get added to those videos. And if you already have the membership, you're going to just get the extra videos as they get added. But the professional plan also has time with a consult with me, a free consult. So we can go over like, what is your health concern? Which videos would I start out with? A lot of families who can't see a biomagnetism therapist will buy one of those buy one of those plans. And then I help them tailor it to their family's need. So you have chronic Lyme and you can't see a biomag therapist. So you buy the videos and I'll say, okay, this week work through with these videos and then start with these and then kind of work through that issue with you. So it's like you're getting fuller treatments at home. And then you can see me in person. I also do telehealth. So you have access to biomagnetism everywhere. With the telehealth, and we go over, I do a full intake and health history, do the session, make recommendations for biomagnetism follow-up. If there's something like a homeopath, I just worked with somebody last week where I think there's like this cell salt that they really needed to help their issue, herbalism, any of the other tools that are in my kit get incorporated into those sessions.
Well, this has been so amazing.
Thank you guys.
Thank you so much. Thanks to everyone who brought great questions and who are leaping in and experimenting with these, I would say, safe to fail, meaning they're not going to hurt you or kill you if they don't work, but potentially high yield and high benefit, transformational health systems that is biomagnetism. So thank you.
Thank you for having me. I'm so glad we were able to do this. And I'm hoping it wasn't too much information, that I made it digestible enough. But I think you'll probably have it, like people can get access to this later. They can always rewatch it. And if you really don't know, you're really confused, you can email me. It's on my website. You can contact me and let me know, and I'll do my best to walk you guys through it.
And what's your website?
Biomaghealth.com, BIOMAG health.com.
Beautiful.
Well, thank you, Kristin, for having me again, and Jerry. I appreciate it for organizing all of it.
Our pleasure. This was a delight. Thank you so much.
All right. Take care, y'all.
Everyone.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.